I'm going to send out the ad here in just a minute too, so everyone will have it. Since it's going to be up to date. You're on that email, so you'll get it too, so you can post it.
Okay, great. Yeah, I've got a post all lined up for the different ones. So today's the working.
No, protect. It's one of the graphic ones. And you can watch it before it goes live, but it's the one that just talks about it's not anyone's featured. It's just graphics and pictures and then people saying, I think someone is joining us. Okay. All right. I'm going to mute myself now and we'll wait till everyone gets on.
Okay. Sounds good.
Okay. Thanks.
Good afternoon, everyone. It is 12:30, so we're going to get started now. Thank you for joining us for this media briefing about COVID-19 vaccine in Idaho. My name is Zachary Clark, and I am moderating the briefing today. A reminder that ASL interpretation is available today. Search for the window for interpreter stubs and hover over the three little dots to the right in the video window to lock the screen in place. For the briefing today, we'll be hearing from Health and Welfare Director Dave Jeppesen and Public Health Administrator Elke Shah-Tulloch. Before we open it up for vaccine-related questions from media, Idaho Immunization Program Manager Sarah Leeds also will participate in the briefing. We will not be taking questions from the public today. Please note that everyone should be muted unless they are speaking. And with that, I will turn it over to Director Jeppesen.
Thank you, Zachary, and it's a pleasure to be with all of you today. We are very pleased that the vaccine rollout continues to go well in Idaho. And I personally am so thankful to the over 388,000 Idahoans who have chosen to get vaccinated so far, and to the many hundreds of thousands of Idahoans who are anxiously awaiting their chance to get vaccinated. The data continues to confirm that the COVID-19 vaccines are safe and that they are extremely good at preventing COVID-19. The COVID-19 vaccine is the best shot we have to keep our kids in the classroom, protect jobs, and save lives. As you may have noticed, we've added additional data on the COVID-19 vaccine dashboard earlier this week. This is part of our commitment to transparency. The landing page now shows Idaho information versus national information. And you can see that 27.7% of Idahoans have had at least one shot, and 17.3% have completed the vaccine series. We are also now displaying the number and percentage of people vaccinated by age bands, which shows that just about 2/3 of those 65 and older have had at least one shot, and almost 1/3 of those 55 to 64 have had at least one shot. There's a new graph that shows by week the total number of doses received by the state and the total number administered, as well as a graph that shows the total inventory on hand and how many weeks of inventory that is at the current administration rate. So for example, for the week of March 14th, there was about 114,000 doses in the state, which is about a week and a half's worth of inventory on hand. The vaccine uptake page did not add any new information, but does provide some different looks at the vaccination uptake data. The demographics and equity page added some new information showing first doses and completed series by age band. There's also a new graph that summarizes by frontier, rural, and urban counties how much of Idaho lives in those county designations, and of all those that have been vaccinated in Idaho, how many of those vaccinations occurred in those county designations. This new graph shows that in the frontier counties, the most sparsely populated in the state, vaccination is happening at the rate that we would expect. This is good news. However, the rural counties are lagging slightly behind what we would expect, and the urban counties are slightly ahead of what we would expect. This remains an area that we will keep a close eye on. The vaccine provider page remains essentially the same, and there's a new tab showing the data from the state's sign-up tool for those wanting to get vaccinated. The data on this page shows the number of people who have signed up but have not yet had an enrolled COVID-19 vaccine provider select them to schedule an appointment. This information is displayed on a county-level map of Idaho and in graph by age bands. And just a reminder that for those interested in getting vaccinated, please take a minute and sign up at covidvaccine.idaho.gov. It is really easy and really fast to do so. Finally, this new page has an interactive tool that will show an estimate for how many weeks it will take to have enough vaccine supply in Idaho to vaccinate a particular percentage of Idahoans 16 and older. So for example, the tool estimates that we will have enough vaccine supply for 50% of Idahoans 16 and older to be fully vaccinated by May 12th, and enough supply for 70% of Idahoans 16 and older to be fully vaccinated by June 16th. On a related point, I wanted to share that the statewide COVID-19 vaccination advertising campaign starts today. In addition to vaccination, the other best tools we have are to maintain physical distance, wear a mask, keep your hands clean, and stay home when you're sick. And with that, I will hand it over to Elke.
Great. Thank you very much, Director. Appreciate you all being here today. I have a few things that, as usual, I'm going to be reviewing with you. I'm going to talk about the Vaccine Advisory Committee touch on some points around health, vaccine equity, and a few other issues. So to start, I wanted to start with our Vaccine Advisory Committee. So our COVID-19 Vaccine Advisory Committee, or CVAC, has been meeting for months, as you all are aware, and they've been providing recommendations to the department and the governor on prioritization of populations to vaccinate when vaccine supply is limited. Very much appreciate the governor giving his praise and accolades to CVAC. It's much deserved. They've been working very hard, and we greatly appreciate all the work that they've done. As a reminder to all from last week's press briefing, CVAC had determined that after people aged 45 and older, both with and without medical conditions, the next eligibility group would be people aged 16 to 44 with medical conditions, followed by the general population of people aged 16 to 44. Last week, on Friday, the 19th, CVAC met to finalize Idaho Group 3 priority populations. This was their last scheduled meeting. Under consideration at that Friday's meeting was how to prioritize congregate settings, as well as several requested reprioritizations of certain essential workers. All the CVAC recommendations were addressed with the governor earlier this week, and he accepted those recommendations. Regarding congregate settings, CVAC recommended that they be prioritized so that the whole congregate setting, regardless of their age distribution or medical condition, can be vaccinated at once, all at one time in Group 3. In congregate settings included by CVAC are emergency shelters and transitional housing, if those groups were not already included in previous prioritizations, dormitory housing for workers, adult correction and detention facilities, group housing for persons in substance misuse treatment or recovery, or with mental illness who do not require hospitalization, residential treatment or recovery facilities, and dormitory housing for students. CVAC also recommended to the governor to not reprioritize restaurant and bar workers, airport workers, banks and financial services, Idaho Tax Commission employees, and a subset of Idaho Power frontline essential workers who work outdoors. This action meant that those essential workers would be eligible in the age band or age and medical condition in which they belong. So to recap what the governor accepted and his statements that he made just a few minutes ago, this all means that the following is the new vaccine eligibility schedule for people who live and work in Idaho. Congregate settings are eligible for vaccine for the whole setting effective today. People aged 45 and older are eligible effective today. People aged 16 to 44 with at least one medical condition are eligible March 29th. And people aged 16 to 44, general population, are eligible on April 5th. So as the governor announced, everyone in the state of Idaho who lives or works here will be eligible on or after April 5th. So that this new schedule will be posted on our coronavirus.idaho.gov site. The next thing I want to touch base on is some work around vaccine and health equity. The department is actively working with the health districts and our other partners to address equitable distribution of COVID vaccines. And as we've discussed in previous press briefings, we continue to collect race and ethnicity data, and we're working with with providers and partners to improve the reporting of that data. In addition, we're looking at the data we have from vaccine reporting and comparing those data to counties based upon their social vulnerability index score. We are using the Centers for Disease Control and Prevention's social vulnerability index that looks at 16 measures to create a score in the main areas of socioeconomic status. So those are things such as poverty level, unemployment, income, educational attainment, household composition and disability, which includes things like different age populations living in the household, young and old, people with disabilities, and single parent households. It also looks at minority status and language. And lastly, it also looks at housing type and transportation. So do people live in multi-unit structures, do they live in mobile homes, do they have transportation, etc. So all of those scores together create a composite or social vulnerability index, and that's what we're using. And the closer the social vulnerability index is to 1, the higher the social vulnerabilities in that county. So doing this comparison between what we're collecting on the vaccine administration when we compare that to race and ethnicity and looking at our social vulnerability score for each county, gives us a picture of where we have areas of greater need that can help inform our vaccine strategies in those areas. So for example, this might look like an increased use of mobile clinics to get vaccines to particular counties, or conducting clinics in locations and by providers that are appropriate for that community in order to meet people where they are and by trusted sources. This work is ongoing, and as I mentioned, we're working with our local health district partners to share data and support decision-making as we look at vaccine distribution and administration across the state. But recently, there was a CDC publication called Morbidity and Mortality Weekly, in which Idaho was ranked second from the bottom from our distribution of vaccine compared to other states when looking at social vulnerability index. And while this may seem concerning, states have been vaccinating different population groups across the US, in which some of that may be what's reflected in this report. And for example, while Idaho focused on some healthcare and some frontline essential workers, such as teachers, other states were focusing on population groups such as multi-generational households. So as we continue to focus on equity in our vaccine rollout, and as our vaccine opens up more and more to different population groups, this is the general population, which is coming up very soon, we anticipate that this will be changing our comparison related to other states across the US. And then finally, just a couple of other vaccine-related information points I'd like to make. And the first is around the Johnson & Johnson or Janssen vaccine. This vaccine continues to be well received in the state and in communities, and we look forward to our supply increasing over time. And there's also some good news in that over the last several weeks, we have been allocated, as you know, we mentioned to you, that we've been getting about 1,900 doses per week after our initial distribution. And we learned yesterday from our federal allocation that for the week of March 28th, we're expecting 9,500 doses. And we're very excited to see this increase. It's not totally the increase that we expect, and we expect it to increase even more. But as we've mentioned, as production of this vaccine is ramping up, week to week, we still don't have a long-term projection, but we learn this kind of in real time, and we are sharing this with you weekly. So at least for this coming week, we have 9,500 doses, and for the 2 weeks following in our 3-week forecast, we don't see anything yet, but we expect that we'll see something by the time we get to our next week's allocation. And lastly, because it is in the news, I want to touch base on the AstraZeneca vaccine. We continue to follow the progress of the vaccine. As a reminder, AstraZeneca is not yet authorized in the United States, but there are US trials that are currently being conducted where it's showing a 79% efficacy against symptomatic disease and 100% efficacy against severe disease and hospitalization. The company is expected to apply for emergency use authorization in the US in the coming weeks. However, as you may have heard, the independent board that reviews the data from the vaccine candidates has reported that they would like to see the company review their efficacy data further. So we continue to watch this very anxiously. It would be nice to have additional vaccines, an opportunity for Idahoans in the near future. So just to end with my overview, I just want to continue to stress the importance of taking protective measures, especially during this springtime. It's a huge time for spring break activities and sporting events, and just that need for people and that desire for people to get together. We are not out of the woods yet. You know, as you're hearing the news, we need more people, and not just in the news, but from us. We need more people to get the vaccine to really feel comfortable that we're all taking all the appropriate measures to take care of ourselves and protect ourselves, especially as the variants continue to spread and we are seeing some increases in cases in the state. So we don't want to see these additional surges of infection. We want people to do their part and limit the spread of COVID, and doing your part in terms of getting your vaccine. And while that is incredibly important, it's also incredibly important to stay vigilant and wearing your face coverings, maintaining that physical distancing if you're around other people that haven't been vaccinated, and doing all of those things that we've talked about in terms of your personal hygiene. So with that, my continual plug to make sure that everybody remains vigilant. We're so close, and I know that we can do this. So with that, I'll turn it back to Zach.
Thanks, Elke. We will now take vaccine-related questions from media participants. We will answer as many questions as possible in the time available. Please raise your hand in WebEx by selecting the hand icon in the lower right portion of your screen. You can also type your question into the chat area. When I say your name, please unmute yourself and announce your name and media outlet before asking your question, and remember to clear your hand when you're done. So the first question will be coming from Scott Logan. Go ahead.
Yes, Scott Logan with Channel 2 News. My question is for Director Jeppesen.
Yes, go right ahead, Scott. Yep.
Yes, thank you. Sir, given the talk about the vaccine, although Elke touched on it, we're not out of the woods yet. I'm curious, where do you think we are now, a year into this, with the vaccine rollouts? Where do you think we are in this pandemic?
Scott, it's a great question. Thank you. You know, we're in a much better place than we were a year ago, for sure. And really the game changer has been the introduction of 3 highly effective and very safe vaccines that are accelerating in the amount that's coming into the state. That very first week in December, we had just 15,000 doses total coming into the state. And this week, we are expecting both first and second doses to be over 90,000 doses coming into the state. So it's been great to see that increase. And so that puts us in a much better place. The vaccine is a very important tool to help us keep kids in class and have save jobs and move forward to some sense of normalcy. But as Elke said, we're not out of the woods yet. We have about 27%, 28% of Idaho that's had at least one shot. And that's nowhere close to the number we need in the long term to really have the coronavirus under control. And we have variants that have been introduced into the state and have started to track as well. And so really where we are is in a race to make sure we get as many of those that want to be vaccinated to get vaccinated, to invite those that are thinking about getting vaccinated to do so. And in the meantime, we really, as Elke said, need to continue to practice those safety precautions of face coverings, hand washing, physical distancing, staying home when you're sick, to really keep the spread of the virus down until we get to a level of vaccination rates that allows us to move back to some level of normalcy. So we're much better than we were a year ago, and we're right in the middle. We have a lot of light. There's light at the end of the tunnel, but we're not out of the woods yet, and that's really where we are at this point in time.
Okay, next up we have Melissa Davlin.
Hi there, Melissa Davlin with Idaho Public Television. I'm not sure if this question would be for the director or Elke, but I've read in other states that opened up the vaccine eligibility to the general population. There was a little bit of a bottleneck, like what we saw when Idaho opened it up to the general population ages 65 and older. Understanding that there's more vaccine coming into the state now, is the state prepared to handle this influx of appointments that people are going to be trying to make over the next few weeks?
Yeah, thank you. I'll start, and of course the director can always jump in. And we are looking very closely at not just our allocation that comes into the state, but also the uptake across the state. And so one of the things that we took into consideration very seriously was there's certain parts of the state that have kind of moved through their priority groups much faster. So we're trying to do that balance of not wanting any appointments to go unfilled, not wanting any vaccine to be wasted, and then also meeting the demands and balancing that with higher population levels that, where you have higher demand in certain areas. So it is going to be that balancing act, but we felt that, increasing who is eligible will help providers. We've heard from a lot of providers that say, we would like to be able to move through our population groups faster, give us that opportunity to do that. And we do have supply coming in that we anticipate can meet that need based upon the uptake that we're seeing. So there may be some pockets of the state where we do still have, a little bit of wait time for some folks to get in, but we have, close to 470 providers enrolled providers across the state that can help you really get the vaccine out to as many people as possible.
And if I could just add to that, we definitely have the enrolled COVID-19 vaccine providers all indicate that they have more capacity than even the increased supply that we're getting now. And the other thing that we saw that was a source of friction and frustration was the ability to get appointments. And so I would just emphasize again the state sign-up tool. It works very, very well. It's less than a minute to sign up, and it's working extremely well. And so that will actually alleviate the need to go out and shop for appointments. If you get on that sign-up list, the providers come pull names down as they have appointments and contact individuals. So I think those two things are what's in our favor as we open it up. Do we think we'll have more people than we have vaccine supply? Yes, but I think we have much better tools and much better capacity than we had back in February 1st when we opened it up to 65 and older.
Next, we have Joe Parris.
Thank you so much. With the exciting news that the vaccine will be opening to a large bulk of people, I was curious if you could address a common question we've had recently. People who have already had the coronavirus and they know for a fact they had it, they tested positive, should they be getting the vaccine? We've had questions about people saying, you know, I think I have enough immunity from just getting the vaccine and I don't feel I need the vaccine. And I'm also curious if the state has any data that is somehow cross-referencing if people who tested positive for the virus are getting the vaccine.
Great, thanks, Joe. That's a great question. And the short answer is yes. We are encouraging everybody who wants a vaccine to get the vaccine. We do feel it's an important tool that we all can have in our toolbox to keep ourselves healthy. And I'm going to ask Sarah Leeds if she has anything that she wants to add around the data part of your question.
Thanks, Elke. Yeah, we don't necessarily collect information on the people who get the vaccine. We don't know what their whether they have antibodies or not due to having had COVID. So we don't know that from IRIS, but we are hearing anecdotally that a lot of people who did get COVID are now choosing to get vaccinated because there is some data about immunity after you get COVID-19, after you've been infected with it, but we don't have hard answers and good solid data on how long that immunity lasts. And so as vaccine is more open to the public, we really are, as Elke said, encouraging everyone to get vaccinated who is able to get vaccinated.
Awesome. And I had a quick follow-up. Dr. Christopher Ball with the Bureau of Laboratories for Idaho had indicated to us yesterday that there were some select cases of fully vaccinated Idahoans that were still testing positive for the new variants that were in our region. I'm curious if you have any indication from a statewide level of what those numbers look like and what the message would be to the community for people who are fully vaccinated but apparently still testing positive for new variants.
Yeah, thanks, Joe. I think we're happy to have it at our next press briefing as well when Dr. Hahn is back in the office, and we also have Dr. Ball available. We can bring both of those folks back on this press briefing, and we can have a deeper dive into that conversation for sure. But yeah, we do know that there are breakthroughs and people being reinfected. We still want to make sure that the overriding message that we get out to the public is that getting the vaccine is very important, and that it, just as Sarah had said, we don't know a lot about how long immunity lasts, and so we are encouraging everyone that is wanting to get the vaccine, and we're making it as easy to get that vaccine as possible. So my recommendation for a better response to your question is to have us bring it up again next week.
Yeah, and Elke, if I could just add to that, I think we should just emphasize that we've always expected that there would be a small number of people who got vaccinated that would still contract COVID. That was the case in the clinical trials. Again, a very small number, and that's certainly been the case here in Idaho. But we must emphasize it's a very small number, certainly under 100. of individuals who have been fully vaccinated and have still contracted COVID. That is to be expected, but we expect that to continue to be a very small number. And some countries that are further ahead of us, they are observing, as we are, less than 1% of people that are fully vaccinated actually contracting the disease, and that's very encouraging. That's a very effective vaccine that keeps that infection rate that low. So, but we can talk next week in more detail about that.
Great, thank you so much.
Okay, next up is Hayat Norimine.
Hi, I'm sorry if I missed this earlier, but I don't think I had heard anyone talk about why the vaccine rollout had been sped up. I'm assuming this has to do with vaccine hesitancy, but I'm wondering if anyone can just say why, this is 3 weeks ahead of schedule. And I have a follow-up question as well.
Yeah, excuse me, I did touch base on that just a few minutes ago. We've heard from a lot of providers that some of them are having unfilled appointments, and they're having some issues with having more vaccine available than they are people coming in. So we wanted to be able to allow them that flexibility to move through the population groups a little bit faster. And we also have that increasing supply. So between, the need for flexibility across the state and the increasing supply, we wanted to be able to meet that request to us, and therefore that's part of the decision that we made about opening up sooner. It will also help us when we look at being able to get the vaccine out into communities even more effectively, when we know that if, for example, we're going out into a community that we have for some of these harder to reach areas, we can vaccinate the entire population at one time. So there's a lot of different factors that go into it, but so yes, speeding it up was important to address both the demand and any hesitancy issues, as well as increasing supply.
Okay, great, thank you. And then just for a follow-up question, I've been hearing anecdotally about vaccine providers, not sticking to the eligibility criteria. How are you ensuring that providers are doing that? Is there any enforcement happening for providers that are not following them?
Yeah, thank you. I'll have Sarah help respond to this as well, but we've been really focusing on taking that educational approach, and when we do hear some of these anecdotes, we reach out to the providers and reinforce the messages that staying with the priority groups is important. I can let Sarah address some of those measures that they've taken in the program.
Yeah, it's just like you said, we have taken an educational approach, and by and large, as we communicate with providers, when we hear of situations where there may be someone's kind of blatantly not following the guidelines, we reach out and have a conversation. And by and large, our providers have been wonderful about correcting any missteps, and it's generally been just a lack of awareness of something or a challenge that they face, that they tried to use their best judgment, and we've just talked them through it. So we really so far have only needed a collaborative approach that's been working very well.
Okay, so it wasn't a factor at all in the decision to speed up a rollout?
Not from the immunization program level.
Yeah, and we wanted to, as I said, we want to be able to respect the fact that there are some areas of the state that do have that need to move through those the population groups faster. So it's, as I said, it's a combination of a lot of different factors that went into play.
Okay, next up is Nicole Camarda.
Hi, I had the same question about vaccine hesitancy and why we sped up. So I'm sorry, I'll just put my hand down. I don't have another question at this time.
Okay. Next is Betsy Russell.
Thanks. I'm Betsy Russell with the Idaho Press. And The governor in his remarks today said that Idaho still ranks above the national average for getting vaccines administered. I was wondering what that's based on, because the New York Times published an updated map just last night showing that Idaho and Utah were the lowest ranked states in the West for the share of the total population who've received at least one shot. And they're showing us at just under 24%. Director Jeppesen, I believe you said that we were at 27 to 28%. What rankings were the governor citing, and how can we look at those rankings to compare Idaho's progress?
Director?
Yeah, so the one that the governor was referring to was the one that's directly in our control, which is of the doses that we've received, how many have been administered. We have been above the national average on that for quite some time. It does fluctuate a little bit as we get new doses in, and it kind of changes the percentage and that sort of a thing, but that's the one that he was referring to. And the other metrics that you're referring to are slightly different. They're a metric that measures of the population, either total or those over 16. Where does Idaho rank? And there, that we actually are doing quite well with the doses that we get above the national average for many weeks now. But however, we have been slightly under in number of doses we should be receiving, and that's been primarily driven by the fact that the allocation formula being used uses 2018 census data. And as all of us on this call know, Idaho's population has grown actually by almost 200,000 since 2018. And so we're not quite at our full share. So our doses get allocated based on 2018 census, but then we're measured against current population, which puts us slightly lower due to a supply problem from the feds. But we feel pretty good about for the doses that we receive, we're doing really well at getting those out. We only have a week and a half's worth of inventory at any one time, and have been for weeks above the national average for doses administered of those we've received.
Great. And Zach, maybe you could send me a link to that metric on how we compare on that particular metric to the other states. Thank you very much.
Betsy, it's actually on our new vaccine dashboard. So if you go to the coronavirus.idaho.gov and click on the vaccine dashboard, we get lots of questions about that. And so you can click on that and it'll pop right up on the landing page.
Thanks.
Okay, next up is Brennen Kauffman.
Hello, this is Brennen Kauffman from the Post-Register. Eastern Idaho has seen a pretty major increase in cases over the last few weeks. Idaho Falls and Rexburg are still ranked as two of the cities in the entire country that have had the highest current rate of cases. I was wondering if you've seen what impacts you're seeing of the vaccine in this area so far, either for people who've been vaccinated or among the general population.
Yeah, thanks, Brennan. And Director, I don't know if you want to, since you were talking a lot about the data piece of this, if you want to take that on, but you know, we are working with the health districts, of course, and they've been doing a great job of working with their local providers and getting vaccine out. And so those are, again, if you look at our freshly updated vaccine site, you can see, you know, some of those tabs, which of course I can't, nothing is working on my computer at the moment to get to that data immediately. But you can see by the providers in each of those areas on that transparency site how they're doing in terms of getting the vaccine out. And in general, you know, when you click on it, you can see that in that health district, they have about 82% of their doses being administered, which is right there, sort of in the higher end, or kind of higher end to middle end of the higher end of the pack when it comes across all the health districts. So I think in general, the vaccine rollout is doing well there, but certainly we are concerned about the increase in cases in that area.
I think you covered that, Elke. I don't have anything to add.
Next question will be from Amanda Rowley.
Hello there. Good afternoon. I kind of a two-part question. I'll get to the first. Back to the vaccine hesitancy. So here in Kootenai County, we're seeing a lot of those available vaccine supplies and appointments because folks are partly opting out. So wondering what is being done to counter this? And I have a follow-up question afterwards.
Well, the director and the governor both talked about, well, I believe the governor talked about it, a new vaccine campaign that's being rolled out right now. We know that there are a variety of reasons why there's hesitancy around vaccine, and depending upon religious, cultural, just beliefs in general. Some people are just wanting kind of cautiously optimistic and watching and waiting to see, what's happening with other people as they're getting the vaccine. So we do have a campaign that's being launched, I believe, today to address some of those hesitancy issues, and you should be seeing those very soon in your different media markets. And that with local education on the ground, working with special population groups and whatnot through the local health districts and their public information officers and partners as well.
And I would just add to that, if I could, Elke, that I think there's kind of three types of what I would call vaccine hesitancy taking place across the state. One is what I would call folks that are probably never going to take the vaccine because of their belief system, and that's not something that they're ever going to believe in vaccines in general, and certainly not this one. That is a very minority part of the state. There actually is a larger group, and we've talked about on this call previously, of folks that believe in vaccines, but they want to wait and see. They really want to wait and see friends and neighbors and how the vaccine works for them and if there's side effects, et cetera. And so that's the group we're really targeting with our advertising campaign. And then there's a third group that we've noticed in the last couple of weeks. And I would describe this group as the busy parent group. And it's the group of folks that are really busy in their lives and are not anti-vax, are very supportive of being vaccinated, but are just kind of waiting, not because of safety concerns, but just because of convenience. And we actually think that group, when we hear from that group, most all of them ask about the Johnson & Johnson vaccine so they can get it done in one shot and be done, and they can run between their activities or jobs and just have to do that once and be done. And so those are kind of the three types of vaccine hesitancy that we're seeing across the state. And our advertising campaign will be targeting really for those last two groups of encouraging folks to come in.
Thank you. I appreciate that breakdown, Director. Kind of one of our other questions that we've been kind of mulling around, so I appreciate that. A follow-up question, if I may. So how is the state and working with local health districts to make sure doses don't go to waste? And on top of that, what's the state's position on, here in Kootenai County, we have Washington residents coming to Idaho for the vaccine, so kind of a two-part there.
Director, do you want to? You look like you're getting ready to speak.
Oh, go ahead. You're good.
Okay. So with the local health districts, they are, because I was stalling out on trying to figure out who's going to respond to this question. I need to restate your first part of your question.
Sure.
Yeah, thanks.
Sure. First, so how is the state and local health districts even working with providers to make sure that doses don't go to waste?
With the waste part, thank you. Yeah. So regarding waste, we definitely want the health districts to be working with their partners to ensure that as they're allocating across their providers, that they are they know that they're going to be used, or they have clinics that are set up. So they're not just necessarily, I'm just going to push you, let's say 4,000 doses when you're not prepared to take those. So working with the providers to make sure they're prepared and they have plans for those doses. Then, not only at the state level with our pre-registration tool, some of the health districts and some of the providers have their own lists as well. So as appointments are made available, then they have local and state opportunities for people to get on those lists. And as the director was saying, with our state tool, providers can go in and pull those individuals down. If we notice on the back end of this pre-registration tool that, for example, in Kootenai County, if the providers are having a hard time filling those positions, that we can go into the tool and remind them that, hey, there is a list of people that are available and are interested in an appointment. So we're kind of like doing a little bit of matchmaking, both at the state and local level with providers. So that's one piece for the waste. And some of them are also creating their own kind of wait lists, if you will, or waste lists. And then the second part of your question.
Do you need me to repeat it, or you're okay?
Oh, yes, please go ahead.
Oh, okay. So thank you. So in regards to addressing kind of preventing that vaccine waste, what is the state's position on Washington state residents coming to Idaho for the vaccine?
Right. I'm clearly not on my A game today. So, of course, we put out a statement to, and the governor did as well, about making sure that people who live and work in the state are the ones that are getting prioritized for the vaccine and are receiving the vaccine. We've done education, as Sarah had mentioned, through our connections with all the providers, reminding them of our policy around just people who live and work in Idaho. So, it could be if in northern Idaho, there are individuals who work in Idaho but live in Washington. We've seen that in many locations where there are people who are here working, but they live in other states. So we're, again, going back to that, we're doing our best to educate as best we can to make sure that they're sticking with that. And, some providers are checking driver's license or requiring proofs of employment and things like that. So again, taking that educational approach to make sure that everybody truly understands what the policy is. But first and foremost, we just want to make sure that people are getting vaccinated.
Thank you.
Mm-hmm.
Okay, next up is Keith Ridler.
I just had a question involving the 16 to 18-year-olds group. I know, and correct me if I'm wrong in this, but Pfizer is the only company that has vaccines for those 16 and up. Moderna is 18 and up. I don't know about Johnson & Johnson. So I guess what kind of problems might that present for getting those kids vaccinated going forward? And then as a secondary question, any insights on when drug companies might have vaccines for all children?
Yeah, thank you for the question. We did talk about this very briefly, or this came up last week at the press briefing, and we had talked a little bit about age of consent, and there's a question around when can people age 16 and 17-year-olds who may want to get the vaccine and their parents may not want them to, how that's addressed. So we do need, I was planning on coming back and addressing that specific question this week, but we need to address that next week. We're working with our Attorney General to make sure we really have all of our information clear for all of you about that. But you are correct on the age grouping. So age 16 to 17 is the Pfizer vaccine only. The Janssen vaccine and Moderna are only age 18 and older. And Dr. Hahn mentioned last week as well that there are clinical trials going on right now for youth for some of these vaccines. And I don't know the status as of this week of those. I don't know if Sarah has anything that she'd like to add, but there are certainly vaccines under trial for people under the age of 16. Sarah, do you have anything to add to that?
I don't. I don't know when Moderna is when they finished their. I know they finished enrolling children, but I don't know where they are in terms of the finishing of the period of after vaccination for their clinical trial, phase 3.
Thanks.
And Elke, if I could just add, particularly for those that are 16, 17 years old, the state sign-up tool is going to be helpful because that way a provider, that's the easiest way for a provider to notice that they go out and say, I have Pfizer vaccine, and I see there's 16 and 17-year-olds out there. And so that's the best way to make that match at this point is to use the state sign-up tool.
Okay, next up we have Sierra Pesnell.
Hi, I'm Sierra and I'm with the University of Idaho Argonaut. I was wondering, how do you think the vaccine will, how do you expect it will affect Idaho's college communities? And what can students kind of expect to, like when their social lives or just the kind of normal college experience might resume to being as normal as possible?
Thanks, Sierra. I think with the governor's announcement today of people aged 16 to 44, basically the entire population of Idaho being eligible for vaccines starting April 5th, that will be a great opportunity for students, university-age students, to get the vaccine. And the sooner that we can get students back into school, the better. Universities are, we also talked about the fact that congregate settings, so student housing is also eligible to be vaccinated right now. So even sooner than April 15th, college campuses could offer that vaccine to their students. So what it means for college age students is that the sooner we can get them vaccinated, the sooner they can get back to kind of life as normal and back to classes.
Thank you.
Mm-hmm.
Next, we'll go back to Hayat.
Hi, thanks. I had a question about the variants, how you're planning for the variants in the coming months, as they'll likely become more and more common in Idaho. And along with that, do we know how, if you have an update on how effective the current vaccines are with the variants, if there's any more information on that, as well as how it affects kids and what the strategy is around children, as some studies show that there might be more spread among children with the variants.
Yeah, great questions. And we're trying to make sure these press briefings are focusing on vaccine-related questions to make sure that we have all the appropriate people here to address your questions as best as possible. I'm going to have Sarah talk about the effectiveness of the vaccines on variants. And I think some of the other questions related specifically to the variants, we can maybe hold off until we can have, I think we can get Dr. Ball and Dr. Hahn to help participate in some of the conversations going forward.
Yeah, Elke, I don't feel like I have the expertise to speak specifically to the variants, without some preparation. So if it's okay, I'd like to maybe provide something after the briefing with a little bit of homework.
Yeah, of course.
Thanks.
Okay, next we'll go back to Melissa Daphne.
Hi there. Thanks, Zachary. I am already hearing from a couple viewers who are having issues making appointments under the new schedule with some private providers who are saying they're going to continue to stick to a staggered rollout. And because they're private providers and not, say, a health district, they're telling people that they have that right to do that. So to clarify, are these private providers like pharmacies or health clinics compelled to follow this new schedule, or can they still do their own staggered rollout?
Again, we are doing our best to make sure we're communicating with those providers to the extent that we can, and trying to keep everybody at least with the same flow and the same population groups. But we also need to be mindful that there are some providers that may just not have the capacity to, with the flow of their patients that are coming in, that they might not be able to do as high a volume. They may need to prioritize who they can make appointments for. And Sarah, and perhaps you can address some of the conversations that you're having with providers right now and kind of helping them work through some of those issues.
Yeah, I think we try to send mass email out when the priority groups change. We make some modifications in Tiberius, that federal planning tool that alert our retail pharmacy partners when the priority groups have changed. So based on the governor's announcement at noon, I went in and made that change, so they should know they can open that up. And other than that, we usually need to reach out to someone specifically. We need information from them about if we need to call them to say, hey, are you aware, and what's your challenge, and is there something that we can do to help? If it's just education, if it's vaccine supply, that vaccine supply right now would be kind of a collaborative effort between the provider, the public health district, and the immunization program. So there's it's a multi-pronged strategy for helping that provider address how they get to vaccinating the group that we're in.
One quick follow-up, or I guess an unrelated question about that busy parent group that Director Jeppesen referred to. This is a group that I've heard more and more about the past couple days nationwide, people who are busy and not necessarily vaccine hesitant. And I know in the past, Elke and Sarah have talked about outreach efforts for some of these rural communities. But can we get some more information about ways that health districts in the state are trying to reach those people who say work night shifts? Are you looking at doing vaccine clinics, not just in a mobile mass site, but at, say, churches or schools or individual community centers to make it even easier for people to access the vaccine if they're very busy?
Yeah, that's a great question. And absolutely the health districts, I know we've heard in our conversations with them, we have multiple times a week we're in conversation with them, and they are using different locations, whether it's a church or a community center or just a bunch of a variety of techniques and locations to be able to reach populations. So maybe something that we can try to accomplish for next week is collecting some of those stories of where kind of the novel locations and techniques that the health districts and providers locally are using, and bring that to you.
Okay, next we'll go back to Brennen Kauffman.
Yeah, so right now the state has about 65% of people over the age of 65 who've been vaccinated. Are you kind of expecting that all of the other age bands are going to be able to get to that level? Do you think they'll take different periods of time to get there? What are you expecting, I guess, different levels of vaccine interest from those different age groups?
Thanks, Brennan. And I'm going to ask the director if he would like to respond to that.
Yeah, thanks, Brennan. I think there's, I think we think about this in two waves. There's kind of the wave of individuals that are going to get vaccinated on their own without any prompting. And then there's the wave of individuals who are not opposed to vaccines, but for the reasons that we've talked about earlier, busy parents, waiting to see, those sorts of things. That is going to be a little bit, we're going to have to work harder to make sure we make those vaccines available in a convenient manner. And so on the first wave, we don't have, we don't know for sure, but we anticipate that we'll probably see more of those folks naturally raising their hand and doing whatever they have to get vaccinated in that older crowd. And we expect that to be less as we move to the younger and younger crowds. And some of the other countries that are smaller, that are slightly ahead of us, or even states that are slightly ahead of us, we've seen that be the case. And so we do expect kind of the quote unquote natural vaccination rates to decline as we get to the younger and younger groups. However, I want to be clear, that doesn't mean that they are opposed to getting vaccinated. It means, as we were just talking about on the previous question, we need to switch our strategy to make to be where the people are. I mean, really the simple version of that is we're going to switch from the people coming to the vaccine to a strategy of getting the vaccine to where the people are, so it's convenient for them to do so.
Okay, and our last question in the chat, Rachel Cohen wants to confirm how many first doses Idaho is receiving each week.
Director, I think you addressed that in your opening remarks, or Sarah can answer that.
I know I don't have the current number for this week. I know last week we were just slightly north of 50,000 first doses, including the federal pharmacy partnership. But Sarah, do you have a current number for this week?
I do. I have those numbers right in front of me. So we got a little increase this week in our allocation. So again, we get an allocation this week, they get ordered, and they are delivered next week. So truly, as I say this is vaccine that will be in Idaho next week. So we have a total, this is first and second, of 90,240 doses. So for first doses, we have 26,910 first doses of Pfizer, and that was a bump from last week. That was a slight increase, several trays worth. And remembering that one tray of Pfizer has 1,170 doses. So we have 15,800 first doses of Moderna. And then we have, as Elke mentioned early on in the press briefing, 9,500 doses of Janssen, and those are, of course, just one dose. So,
And Sarah, can you also just mention what we see in the federal pharmacy partnership as well, because that's additive to that number?
Yes. Oh gosh. I don't have that number right in front of me, but they will see a commensurate bump. So in what the state allocation saw. I may need to email that to Zach to send out.
I believe I have it for the projected weekly allocation of pharmacy partners, 64,520.
Great, thank you.
Okay.
Sounds correct, Sarah.
Seeing no more questions, we will wrap it up for today. We're planning another media briefing about COVID-19 vaccine next week at 2:30 p.m. Tuesday, March 30th. Watch for those details on Monday. Thanks, everyone.
Thanks.